My name is Sharon. I'm Associate Professor at the Singapore Institute of Technology, and I'm also the Program Leader for the Bachelor of Science with Honours in Radiation Therapy. Right, thank you for being here. I think it's a very early morning slot to be here. I thank you for your presence. So along the way is keep it informal. If there's any questions, feel free to put your hands up, or towards at the end of it, approach any one of us. All right? Okay, so let me start. I think the first question that sits in everybody's mind is, what is radiation therapy? All right, I mean, for a young school leaver who has just recently completed your studies, you'll be wondering, what is radiation therapy? You know, what do radiation therapists actually do? So let me start off with telling you what exactly a radiation therapy is all about. All right, it's the use of very high ionizing radiation to treat cancer patients. All right, so what the radiation does is that it actually kills the DNA of these cancer cells to stop it from multiplying or dividing. In medical terms, we call it metastasis. So you know, cancer cells, if it's out of control, actually spread to all parts of the body. So it is detrimental to the health. So radiation does that to kill the cancer cells. Who are the ones who administer the treatment? We call themselves the radiation therapists. So at the end of this 4-year program, you will graduate to be a certified radiation therapist practitioner with MOH, so which means that you are licensed to dispense radiation and treat cancer patients in your practice. And what do we really do? As radiation therapists, you know, we see patients from as young as a couple of months to as old as maybe 80 or 90, and we see a wide range of patients, right? We see from a little child. I mean, my youngest child I've treated was actually a 6-month-old baby, and of course we have a lot of other patients that needs treatment with radiation. So as a radiation therapist, I think a lot of time we spend not just treating the patients, but I think also we need to be able to communicate with them. All right, to lend a helping hand, to be there to walk along this journey with them, and to provide lots of counseling and talking to them. So if you are someone who enjoys talking to patients, who like to have this kind of interaction with patients, I think this profession will definitely suit you a lot. So let me just show you a snapshot of what a radiation therapist do. Let's hear it from a radiation therapist herself.
A radiation therapist delivers radiation doses to kill cancer cells. I liken myself to a sharpshooter. I have to be very accurate in the treatment delivery. People often think that we are subjected to a lot of radiation, but it is not true. We leave the room after positioning a patient. There are many opportunities for career development and to branch out to do different things like research or advanced practice even, as well as to go for international conferences, local conferences, and postgraduate studies. When patients are under immobilization gadgets like the shell and the mask, they may feel claustrophobic. We have to reassure them constantly, tell them the reason why they have to be under the immobilization gadgets, and just offer words of comfort all the time.
Right, so it is actually a very rewarding career because you get to mix with a lot of, you see patients and you see them recover, and coming back after their last treatment to say hi, to say, hey, hi, you know, I'm cancer free. That is the best news that we can actually have every time when we do that. Do you like to work in a hospital? All right, I'm telling you this because some students, when they come for interview, they ask me, you know, Prof. Sharon, you know, can I like talking to people, I like talking to friends, I like talking to my family members, but I don't want to work in a hospital, I don't want to see patients in the ward. Then I was thinking, oh, okay, maybe this is not something for you. All right, because you must understand that your environment is going to be in a hospital setting. You will see patients in all forms, all right? Some of them can be a healthy individual, some of them not so, okay? They can be on the bed, on the trolley, or on the wheelchair. So you must be able to know that that is going to be your environment, and you must feel comfortable about it. The other thing you'll probably have to ask yourself is whether do you want to do something that is meaningful to others, to help lend a helping hand? All right. And one more thing very important is that you need to know that in healthcare, you will be faced with situations that you're going to see blood. Right? You're going to see patients that are not well. Cancer especially, you see patients, some tumors that can be a little bit unsightly, they can be growing out from the body, and you need to be able to accept that. All right. Again, many times when I talk to my potential students in open house like that, they'll ask me, you know, Prof, I really like talking, I really like to work in a hospital, and I like talking to patients, but I cannot see this, cannot look at blood. All right. Or when I look at somebody bleeding, I will faint and collapse. Then I would think, okay, in an actual situation, if you're in a hospital where every time time is an essence, how am I supposed to rescue my student who has collapsed because she saw blood? Or do I save my patient? So, okay, so I think we have to really look at it very carefully, examine yourself, what suits you better. All right. The other thing is also whether you like to work in a team. All right, teamwork is very important in healthcare. All right, we don't treat patients alone. In fact, we need a whole kampong to help us treat our patients. We work very closely with the doctors. We work closely with the nurses, the physiotherapists, occupational therapists, the whole team to help our patients because patient is our number one priority. So you must be able to want to work as a team, okay? It's not going to be a desk-bound job. I must be very honest with you. Healthcare may not be your cup of tea, but it's not going to be this way. As you know, SIT is the only university in Singapore that trains allied health programs. All right, radiation therapy is one of the 5 allied health programs. You can't find this any program in any other universities. So if you want to join an allied health profession program, you have to apply to SIT. SIT is different again from the other universities is that it is a very applied learning. Because I remember I mentioned we had a lot of hands-on experiences. We need to be talking to patients, we need to be running here and doing a lot of things. It is an applied university in the sense that we don't just teach theory, all right? We don't have 4 years of just theory. In fact, we integrate theory with hands-on practice and clinical attachment so that you are able to learn the theory, apply it to your patients, and learn and come back to school, we discuss, and slowly scaffold you so that at the end of these 4 years, when you go out into the workforce, you are not starting from scratch because you already learned, you already know how to do it along the way. All right, and we have very close collaborations with universities and with all the public hospitals. So we actually send our students out for their clinical attachments during the 4 years. All right, so this program, it comprises very innovative curriculum and pedagogy. When I say innovative, that means it is different from the norm. All right, we do not just have lectures. The students don't just come to school and sit for 8 to 5 hours of lectures, one way, and then they go back and then they study. No, we have a lot of activities for the students. So they may have a week, Monday they may have a lecture, and then Tuesday, Wednesday they may be going for practicals in the hospitals. We have expert radiation therapists or doctors who come in and give talks to them, and then there are tutorials to help them along the way. So there's a lot of discussions and not just a one-way kind of teaching. So if you are a student who like a lot of hands-on, you like to have be in the action, I think allied health or radiation therapy is going to definitely be something that you will enjoy doing. They carry the VR. They use the VR to have that experience, the virtual environment. We also have like all these little simulators to simulate the actual environment so that they are prepared when they go out to the hospitals and they start seeing patients. It's not something unfamiliar to them because they have enough practice in school virtually, all right, with all the various systems that we have. Okay, this one gets all my potential students very excited. Assessment, how are we going to be tested on our assessment? All right, everybody gets very worried. So what happens is that we do have a mix, all right? We have our written assessment, which I think most of you are very familiar with. At the end of module, end of trimester, you have the examination, which is paper-based. We also have what we call the OSCE, which is the Objective Structured Clinical Examination. Because in healthcare, I mean, we can't describe a procedure by writing down. We have to show by action, all right? That is the fun part. You have to demonstrate that you can actually know what you are doing. So my students, they will go through what we call the OSCE examination to test their clinical skills. And some of the clinical skills that they will be tested will be maybe communication. So I will have a patient, a real patient, who will sit across the student, and the student will have to tell me, demonstrate that you are able to communicate with the patient right in front of you. You are able to do the physical examination on the patient. So this is the hands-on practical part. So let's hear it from my students who did this video to see what is the life of an RT student like in a day.
Oh, hey, sorry. Hi, may I just know what course you are from?
I'm from radiation therapy.
Oh, that sounds really interesting. Can you tell us more about it?
Do you want to join me for today?
Actually, that would be great.
Let's go.
Right now we are having a lecture on one of our RT-specific modules called Principles of Radiation Therapy. Right now we are learning about gynecological cancers.
Okay, so what are you doing right now?
So right now I'm having an online lecture. Some days we have online lectures and today is one of them. This module is cross-sectional anatomy and right now we are studying the brain. Right now we are going for a tutorial. It's a health research method module. So we are going to be learning how to analyze quantitative research paper. Yeah, let's go. So basically we use this software called Stata and we will be analyzing the data that we will receive so that we can analyze a quantitative article. So we are done for today. After this, we're just gonna go home, study revise what we learned, and then yeah, that's all.
Oh, for me, I think AMP is very fun. AMP means anatomy and physiology. There's a lot of content, but if you study, you can make it.
The most memorable experience so far will be our first 3-week clinical block that we just had. It was a very eye-opening experience and it really changed a lot of my perspective about this course. And from this 3 weeks experience, kind of developed a deeper passion for this course because I can see how meaningful and how it impacts, how it brings impact to the patient's life. Yes.
The favorite thing about RT so far is the people that I've met in this course. Because our course only has 10 people, so we are a really small class and we are always very bonded. And rather than being competitive with one another, I feel that it's more like we are all running this race together.
Right, so nothing beats seeing or hearing from the students themselves, right? Because they'll say, "Hey, Prof, you're always, you're not talking the same language as as the students." So I thought maybe this time around I get my students to share their experiences. So this is what they came up for, all right? So it's not just me talking about this program, but the students are actually sharing how they feel about this program. At the end of 4 years, there are also many other career opportunities, all right? If you think that, okay, I have been a clinical practitioner, I have been working in the hospital, what are things can I do? You can actually be an educator, all right, join the academics. You can be a researcher, all right, you can be an application specialist. So there are a lot of avenues for you if you want to branch out. Of course, majority of my graduates actually continue to serve in the hospitals to serve patients. Okay, I want to be very honest. Okay, I'm not going to say that this course is very easy. Okay, you can talk to my students. It is intensive. Okay, it requires some hard work as well, because you need to study, you need to be able to apply, right? You need to juggle between all the clinical placements. So it is intensive. It's quite challenging, I must say, but it is manageable in the sense that if you follow closely, all right, do your reading, do your work, it is possible, all right? So don't let me frighten you off like that, okay? But I just warn you that it is going to be intensive, all right? It's not something that you can just go for lectures and expect to pass at the end of it. You do need to do your own self-revision and be on top of things. There is going to be a lot of clinical hours, all right? A lot of patient interaction. You will be attending to a lot of patients. Okay, if you think that you are going to pass through these 4 years without seeing any patient or without having to talk to patients or seeing blood or seeing any patients in different stages of their disease, then I'm sorry, you will be disappointed, because you will be facing and seeing patients of different stages of the health. Honours thesis it is the capstone project for all our students in year 4. So they have to come up with a research problem that they see pertaining to their program, and they work together as a group to fulfill that. Right. So it's usually a one year duration program. It's like a research thesis project.